Montreal is now in the orange zone, but it is up to us, all of us, to do everything we can to limit the spread. And we can do it, and we must do it. We're in the orange zone because, of course, there's an increase of cases. This is something we need to take very seriously, and this is why also we're putting together measures to limit the outbreak. And I just want to remind everybody that we all have a responsibility. There seems to be, a lot of cases coming from the private sphere. As we go home, once we step in our house, we need to continue to be vigilant. We need to continue to apply all the measures that we know about outside, whatever it's at the workplace, in school, in public transport. There's a lot of protocols. It's efficient. It works very well. But then once we go home, and if we are thinking about having family for dinner or friends, we need to keep in mind that the measures needs to be up and running. And that means now it's about, if you want to receive people at home, it's up to six people and two different addresses, not more than that. I also want to say, and I know it's difficult, I want to, let's acknowledge that we do want to see our friends and family, but we're getting into, well, definitely we're in the second wave, but we want to limit the damage for sure. So there are things we need to adapt to. Again, we have shown that we're capable of doing it. We've been quite vigilant here in Montreal, and I want to thank all Montrealers for all their sacrifices, but we need to continue the fight. And at the end, I think we all know why we're doing this, because we want our kids to continue to go to school. We want our businesses to run. We don't want to close economic activities. And all that we want, and finally, we want to be healthy. That's what we want. We want everybody to feel safe, and that we can continue on a longer term to see each other, but in a very, very safe way. So Montrealers, it's up to us.
Should Montrealers be getting ready psychologically for the red?
I mean, I am, because I think we went through the first wave, and it was so difficult. So as mayor, I am, and the good thing is that we've learned a lot from the first wave, and how we can deal with, how we can be a good complement to public health and the government and the health network. But at the same time, even though we get prepared, we never know how the virus could evolve. Would it hit the same way, the same population? It's the CHSLD, for example, would it be totally different? So it is not an easy one, and I don't want people to live, I don't want Montrealers to feel anxiety, but I think we do need to keep in mind that until we get a vaccine, we never know what can happen. We don't know.